Okay, good morning, everyone, and welcome to today's webinar presentation on promoting health, a reintroduction to program evaluation. My name is Dan Johnson, and I'm an education specialist on the capacity building team here at PHO, and I have the pleasure of moderating today's session. So before we begin with today's presentation, I'll just mention a few housekeeping items. So to enhance the presentation experience, participant audio and video has been disabled. However, we're using the chat pod to encourage discussion that way. So please use the chat pod. Also use the Q&A pod if you have questions during the session, and a discussion and question period will follow the presentations. If you have any technical issues at any point during the session, please email us at capacitybuilding@oahpp.ca. And now it's my pleasure to introduce the speakers for today's presentation: Andrea Bodkin, Kyley Alderson, and Rachel Ackford. Andrea has worked in health promotion and public health since 2003. As a senior program specialist in health promotion with Public Health Ontario, Andrea brings her enthusiasm and expertise for planning in all forms, evaluation, community engagement, partnership development, and facilitation to public health units across Ontario. Andrea holds a master's degree in public health with a specialty in health promotion from Deakin University in Melbourne, Australia. Kyley is a health promotion specialist at Wellington-Dufferin-Guelph Public Health. Her role includes research and knowledge translation, program and policy development, project management, program evaluation, and community engagement on a variety of different topic areas to help build healthy communities. Kyley has 13 years of experience in the health promotion field and holds a master's degree in public health with a specialty in health promotion from the University of Alberta. And Rachel holds a Bachelor of Biomedical Science and Master of Public Health from the University of Guelph. She works at Wellington-Dufferin-Guelph Public Health as a health promotion specialist on the health promotion team. Part of her role at Public Health is to support research, evaluation, and knowledge exchange. She is also pursuing a part-time PhD at the University of Guelph with the Guelph Family Health Study. And Rachel is a former placement student at PHO. So nice to see you again, Rachel, for that. And I think I'm going to pass it over to Andrea to get started.
Thanks so much, Dan, for that introduction, and thank you everyone for being here for the third of our three-part series, a reintroduction to health promotion. We are hoping that this series of webinars is going to help you get reacquainted with what health promotion is, because many of us have been away from our core work for the last 2.5 years. And so this series of webinars is really intended to reintroduce us to some basic concepts. And today we'll be focusing on evaluating health promotion programs. As Dan mentioned, my name is Andrea Bodkin. I've been at Public Health Ontario for about 4 years or so. I identify as a white cisgendered woman of settler ancestry. My ancestors came to southwestern Ontario in the 18th and 19th century and cleared and farmed the land. And I'm very aware that the privileges that I hold today, I am educated, I am employed, I have a safe place to live, I have strong family relationships, and many other privileges. Those privileges are a direct result of the decisions that my ancestors made, and I recognize that. That's one of the reasons that it's important to me to do land acknowledgements. And today I am broadcasting from my home, which is in Takaronto or Toronto, beside the Wescotanach River, the Don River it is now called. And this particular area of Takaronto has been home to Indigenous peoples for about 11,000 years. Most recently, the land's been in the care of the Mississaugas of the Credit, which today are a vibrant community both on and off reserve, just outside of Hagersville in southern Ontario. One of the things that I am trying to bring to my own practice is this wonderful teaching called two-eyed seeing, where with one eye I see my traditional Western practices, my traditional education, and with the other eye I try to be aware of Indigenous ways of knowing. And I think in particular this week, we're in the third week of July, and the Pope is currently touring Canada right now on a bit of an apology tour to First Nations, Métis peoples, and Inuit people. And I think it's really important for all of us to be aware of the problematic history in this country and try to do a little bit better. So I'm going to dive into some of the content now. So in today's session, I'm going to present some general concepts related to program evaluation, what evaluation is, why you might want to do some evaluation, and I'm going to go over the PHO's 10-step process for evaluating health promotion programs. And then Rachel and Kyley from Wellington-Dufferin-Guelph are going to provide an example of an initiative that they've recently evaluated, just to make that model come to life a little bit. We're hoping by the end of the session, you'll be able to define evaluation, you'll recognize the importance of evaluating health promotion programs, and you'll be able to describe the 10-step model to evaluating health promotion programs. All right, so let's go over a little bit of this content. I'm going to start by talking about what evaluation is and what evaluation is not. And in terms of a definition of evaluation, I am going to use the Canadian Evaluation Society definition, which is also the definition that the Ministry of Health uses in the public health standards, which I'll talk about in just a second. And they define evaluation as a systematic assessment of the design, implementation, or results of an initiative for the purposes of learning or decision making. It's a pretty complex definition, so let me break that down just a little bit. The evaluation should be systematic, impartial, and methodological. It should consider value, merit, and worth of the initiative you're looking at. You can evaluate programs, projects, initiatives, policies, components, partnerships, elements. You can evaluate a whole range of different things. And there are a whole number of purposes, of reasons why you can conduct an evaluation, and I'm going to get into that in just a second. In terms of what evaluation is not, it is not the same as research. When you're conducting research, you're generating new knowledge, but evaluation, you're critically examining your program, your initiative, your characteristics for the purposes of decision-making and action. It's not always done by an external third party. And in fact, PHO's products, the evaluation model, the program planning model, we have a policy development model, all of those things are designed for health promoters to do, because we don't always have budget to conduct evaluation. We don't always have budget to hire consultants. We can do these things ourselves on a smaller budget when we need to. And evaluation is not just surveys. You're going to get a survey at the end of this webinar. I just did a poll question, which some might consider evaluation. Evaluation can be surveys, but it can also go beyond that. You can do focus groups, key informant interviews. You can do research questions. There's a whole bunch of different methods that you can select to get the information about your product or your program. And evaluations are not always done at the end of a program. They can be done throughout the life cycle, and I'm going to talk about that too. So why should we evaluate? Well, there are a lot of reasons, but for those of you who are working in Ontario's public health units, I'm going to start off with the public health standards, which mandate that we do particular things to assess our programs. And again, this is the Canadian Evaluation Society definition grounds these Ontario public health standards. So in the standards, they state that we want to be able to demonstrate the impact of our public health programs and services and measure the outcomes of those program and population health services. So really what we're trying to do here is discover how if the program was needed, how the program was implemented, and what was the impact. However, there's a whole bunch of other reasons. In addition to, you might need to meet your funder requirements. You might want to be able to demonstrate value or measure the effectiveness or impacts of your program. You might want to identify areas for improvements. Through the process of evaluation, you might want to build trust with partners and community. You might want to contribute to the health promotion evidence base, which is sorely needed, because while we understand the need for a lot of our health promotion programs, we don't always understand what's best to do and what is most effective to do. So publishing your evaluation results in whatever way, shape, or form you can help to contribute to that evidence base. You can evaluate throughout the lifespan of your program. There's even a type of evaluation, which many of you might not think of as a type of evaluation. It's called a situational assessment. Sometimes you think of it as a needs analysis. And typically we do that before we develop a program to figure out what the situation is, what's making the situation better and worse, and what can we do about this situation? And that lays the groundwork for your program. Then throughout the development process and the implementation process, you might be doing some monitoring. You might have particular milestones that you were supposed to achieve, or there might be particular stages that you're evaluating at. For instance, if you're working with a group of partners, you might do a baseline evaluation at the beginning, you might do some checking in towards the middle, and then you might follow up towards the end. There's also some evaluation work that you can do towards the end of your initiative. Again, you can look at the impacts, you can look at have you achieved your goals, you can look at processes. So have you implemented everything in the way that you have wanted to? Sometimes we evaluate at the end of a pilot, and then that information can be used to help us to roll out or to expand our program. What's most important here, no matter when you are going to actually conduct your evaluation, is that you were thinking about your evaluation as early as possible. Way back in the development stages of your program, if you think back to last week's webinar and our program development model, you're planning to do evaluation right from the very beginning so that you are designing your program in a way that it can be evaluated. And that is what is the critical take-home message here. Plan on evaluating. Whenever you're going to evaluate, just build those processes in at the very, very beginning. So I'm going to just quickly introduce you to PHO's 10-step model for evaluating health promotion programs. As with program planning in last week's webinar, there's a wide variety of evaluation frameworks and models and processes that you can use. The information that I have gotten at the beginning part of this webinar, I've pulled from 3 different sources, and I'm going to pop those links into the chat box shortly. And this particular model, again, held here at Public Health Ontario, specific for health promoters. And this particular model is a goal-based approach to evaluation. And what it emphasizes is that you are planning to achieve specific goals in your program. So again, go back to our program planning process, and you identified what is it you want to achieve as a result of your program. And then you're going to measure if you achieved those preset goals. That's the focus of this particular model. In last week's webinar, Lisa Gallant from Niagara region talked to us about a particular word that you can see here in step 2, and that word is stakeholder. And just last week, when Lisa courageously taught me, and maybe some of you this, some of the problematic history with Indigenous communities and the use of the word stakeholder. And so I am re-examining using that word personally. I'm doing some reflecting, and sometimes I forget and sometimes I remember not to use that word. And I hope that over time we're going to be able to consider that with a number of our PHO products. But I just wanted to mention that even though I'm becoming aware of the problematic nature of that word, and I will pop a blog post into the chat a little bit later, there are still some of our existing tools that use that word. So I just wanted to quickly give you that heads up. Also to mention that this model is displayed in a linear fashion. We've got step 1 all the way through to step 10. You can see that there are up and down arrows in this model, which indicates that sometimes this work is a little bit circuitous. Sometimes you go back and forth. Sometimes you have to go to the beginning or skip to the end, or realize you didn't define your question, or you have to engage your partners in your community, and then you have to go ahead and collect that data. Sometimes it's extremely circular. So this is just kind of the nutshell version of this 10-step process. And rather than going through step by step, Rachel and Kyley are going to take us through step by step and give us a terrific example from their community of an evaluation that was recently conducted. So here are my references. Like I mentioned, I'm going to pop some links into the chat for you. And please be in touch with me if you have any questions or comments, or if there's anything I can do to support you. Over to Kyley and Rachel. Thank you so much.
Thank you, Andrea, for the introduction. We would like to begin today by acknowledging that the land on which Wellington-Dufferin-Guelph Public Health operates is part of the treaty lands and territory that is the traditional, current, and future home of many First Nations, Inuit, and Métis people. Kyley and I both work out of the Guelph office. So today we acknowledge the Mississaugas of First Credit and the Anishinaabes people on whose traditional territory we are meeting. Our health unit is committed to providing services for all Indigenous people and will continue to work towards making them culturally appropriate and safe. Not only do we want to provide services, but we also want to work to address and reduce social inequities that can impact the health of an Indigenous person, their family, and their community. We are grateful to have the opportunity to work on this land, and by doing so, we give our respect to its first inhabitants.
Thank you, Rachel. So today, Rachel and I are really going to be talking about an evaluation that we led of Guelph's overdose prevention site using Public Health Ontario's 10-step framework. So for those of you who aren't familiar with an overdose prevention site, it's a temporary site that provides a safe, hygienic space for people to use pre-obtained drugs under supervision. So there's staff working on site who are able to monitor clients after they've consumed drugs and respond if it's needed, providing naloxone or other life-saving measures if it's required. So in response to the increasing opioid-related deaths and harms that were being seen in Guelph, as well as strong support for an overdose prevention site among people who use substances in Guelph, as was identified through an earlier needs assessment, community partners, including the Guelph Community Health Center, the Guelph Family Health Team, and ARCH, they partnered to establish Guelph's overdose prevention site, and they received temporary approval and funding from the Ministry of Health and Long-Term Care. So just to give a little bit more context about this program, it launched in May of 2018, and the services offered at this site include a safe and legal space to use drugs, harm reduction supplies, response to drug poisoning. I have in brackets overdose there, as that is language that many of us may be familiar with seeing and may be more familiar with, but we're trying to be mindful of the language we use and really refer to these adverse events as drug poisonings, as that really is what it is. Other services offered include an on-site nurse and peer support, as well as referrals to other services and resources. So at the time, the site was open 7 days a week from 10 a.m. to 5, and they had 2 separate rooms. One was an intake and post-consumption room, and one was a consumption room where they had 2 injection booths. So I say at the time because this program opened in 2018, our evaluation was conducted in 2019, and this overdose prevention site has now transitioned and moved into a consumption and treatment service site. So that leads really nicely into what step 1 of this evaluation framework is, which is to really clarify what it is to be evaluated. So it's really important to have a clear understanding of the population, the program activities, as well as the outcome and goals of the program. So an evaluation committee was actually formed prior to the overdose prevention site opening, which, as April mentioned, was really important because you want to be thinking about evaluation right at the beginning. So this evaluation committee had a clear understanding of the program goals and activities. And as well, there was also ministry requirements in terms of indicators that needed to be tracked for this overdose prevention site. So having this evaluation committee in place early on, we were able to set up the appropriate data that needed to be tracked so that when we needed to report this data, we had that data available to us. But in addition to just meeting the requirements for the program, we were thinking about evaluation as well, what questions we would want to answer so that we had that data that we were already tracking and we'd be able to collect that and use that later on when we were to do the evaluation. The evaluation committee determined that the purpose of this evaluation would be to inform key partners as well as the community about the need for, use, and outcomes related to the overdose prevention site, to inform longer-term services and programs and other actions in the community to support safe substance use and prevent drug poisonings, and also to complement and add to the findings from a local needs assessment that was done the previous year.
So after we clarify what it is we want to evaluate, step number 2 is to engage key people. So for this step, you want to engage key people as a way to build support for the evaluation. For our evaluation, many community partners came together. The following partners were included in the planning and implementation of the evaluation. We have Toward Common Ground, the Guelph Community Health Center, where the site is located, HIV/AIDS Resources and Community Health, also known as ARCH, and Wellington-Dufferin-Guelph Public Health. The evaluation committee also included a peer with lived experience who had worked directly with clients of the overdose prevention site. Wellington-Dufferin-Guelph Public Health became the lead agency to plan and conduct the evaluation because we were not involved in operating the overdose prevention site. And so as a committee, we met regularly to develop the evaluation plan, to review materials, make decisions, and provide updates about our progress and process.
So for this next step, the purpose of this is really to assess available resources for the evaluation and to determine whether the program is ready to be evaluated. So in terms of whether the program was ready to be evaluated, as I mentioned earlier, the evaluation committee that was formed earlier had set up the appropriate data tracking mechanism so that we were able to have that data available to us. The data was obtainable, so that was a necessary step. And also the program itself, the pilot program was running for about 10 months at this point in time. So it was a good time to be able to take a look and see how the program was doing, what outcomes it was achieving, because enough time had really passed to be able to gather that data. Leadership and buy-in from partners involved is also really important. And in this particular evaluation, we had significant buy-in for this, and especially because at this point in time, the partners were actually working towards obtaining a successful funding application for a more permanent consumption and treatment service site. And so there was really the need for the evaluation, the findings were going to be used, and so that's really important part. But because of the timing of the application, it really did result in a quicker turnaround time than we were really anticipating. So we did have to scope down to the design of the evaluation a little bit in order to make sure we met those timelines, because it was really important to get those findings and include them in the application. We also had a limited budget for this evaluation. So our health unit conducted a needs assessment the previous year where we conducted interviews with people who use substances in the community to really better understand substance use behaviors, but really identify what programs and services were needed in the community. And we were able to hire peer researchers, so people with lived experience of substance use, also with rapport in the community, and we're able to provide that training so that the peer researchers were able to conduct the interviews. And that process worked really well. There was a lot of great benefits to having that process. And it would have been great to be able to do something similar for this evaluation. But unfortunately, with the time constraints as well as a limited budget, it's not something we were able to do for this evaluation. So it really is important to design your evaluation based on the resources that you have available. So Public Health provided 2 health promotion specialists, Rachel and myself, to serve as the evaluators, and we were also able to provide funding for gift card incentives. Another consideration that we were looking at this point in time was assessing the quality of data sources beyond just the site, but looking at broader community level data. So based on review of literature, some of the conversations we had were around considering including neighborhood level crime data and safe disposal of needles and seeing if we could include that. But ultimately, we did not have good quality data available to us in those regards, and certainly not at the level and quality that we would need to be able to be confident in how we were interpreting that data and connecting it to the overdose prevention site. So it was decided that the data quality wasn't there or good enough for us to use in this evaluation. So we we decided to have the scope of the evaluation really focused on client outcomes and service improvement, and to not include broader community impact at this time, although it was something that we were definitely considering that could be included in future evaluations.
So step number 4 is to determine the evaluation questions. So for this step, you want to pick evaluation questions that will meet the goals of your evaluation. For our evaluation, we developed our questions in consultation with the evaluation committee to really make sure that we were meeting everyone's needs or interests and making sure we were taking that into account when creating the evaluation questions. At the time, we decided that a process and outcome evaluation was needed because we wanted to be able to determine if the program was operating as planned. So thinking about wait times, staff roles, how many people are using the site, the reach. And we also wanted to be able to determine whether the program was meeting its goals. So was the site preventing deaths, and was it facilitating safer substance use? We ended up with 3 evaluation questions. The first question was, what are the strengths and challenges of the site? The second question was, what are the positive and negative short-term outcomes for clients associated with use of the site? And the third question was, is an overdose prevention site an effective way to keep people who use substances safe in our community?
So step 5 of the framework is really to determine appropriate methods. So the purpose of this step is to identify the most feasible and credible methods to use and how data will be collected. So we decided to use a mixed method design, which would allow for both objective statistics as well as subjective context. So the subjective context was really important in this particular evaluation, wanting to have a better understanding of experiences and context in that way. So allowing for more in-depth, richer data. So we decided to perform interviews with clients and staff of the overdose prevention site. So the interviews included both open-ended questions, so we could collect that qualitative data, which, as I mentioned, really helped with the context, experience, a deeper understanding. And we also included closed-ended questions in the interview so that we were able to quantify that data and generate some statistics as well. We also reviewed their internal program tracking data, again, to allow for that quantitative data piece and that numeric information. A really important point that I want to mention is when you're looking at developing methods and how you're going to collect data from participants, a consideration of the ethical risks is really important. And so we completed a comprehensive ethics review and submitted it to our health unit's research ethics committee, and we did receive approval to proceed with the evaluation.
So after picking appropriate methods, step 6 is then to develop an evaluation plan. So what you really want to do for this step is identify specific activities, roles, resources, and deadlines or timelines for the evaluation. So with input from our evaluation committee, we developed a plan and several key documents. Some of those key documents include an evaluation framework, a data analysis plan, an interview protocol, an interview guide, an information letter, as well as a consent form, and recruitment posters. The evaluation framework included a matrix that described measures of interest, data sources for those measures, data collection methods if we needed to collect data to speak to those measures, roles, as well as the timelines for the various steps in the evaluation. This matrix matched up relevant measures with our evaluation questions so that we knew why participants were being asked certain questions or why certain program indicators were being pulled from an internal tracking database. Doing that planning up front was actually really helpful because when it came time to analyze the results, we knew exactly how the responses we had received would then answer our evaluation questions.
So step 7 is really to collect the data. And so the purpose of this is really to collect credible evidence so that we're able to answer each of the evaluation questions. So in our instance, the interview recruitment was done through posters and cards that were handed out at the Guelph Community Health Center, which is the location of the overdose prevention site. So that was handed out in advance of the evaluation. And so after we completed the pilot testing of the interview guide and we were ready to start with the evaluations, the evaluators, Rachel and myself, we spent approximately 16 days on site interviewing clients and staff. So that was between February and March of 2019. And just to explain a little bit about the process here, so staff working at the overdose prevention site provided a warm handoff to introduce clients to Rachel or myself. And we would then have a conversation to chat and speak a little bit more about this evaluation and to better understand if this is something that they wanted to participate in. So if clients were interested in being a part of this evaluation, we then had a private room that we then went to together to ensure privacy and confidentiality. And then we went through an informed consent process to really make sure that the people we were interviewing understood and were able to repeat to us what the purpose of the evaluation was, and that they did want to agree to participate and consent to doing the evaluation, the interview. As evaluators, we followed a structured interview guide and we manually entered the participant responses into an online survey. In total, we completed 51 client interviews, which was about half of the unique clients that visited the overdose prevention site during the interview time period that we were there, as well as 14 staff. So almost all of the staff voluntarily participated to be a part of this evaluation. An evaluator, which was Rachel in this case, retrieved data from the site's internal tracking database as well. So we were able to pull data from the time that the site opened in May of 2018 all the way to March in 2019.
So after collecting data, step 8 is to process the data and then analyze the results. So for this step, you want to enter the data, check it for its quality, and analyze it to find the results of your evaluation. So for our evaluation, the interview responses were exported from an online survey tool into Microsoft Excel, along with the internal program tracking data that we had received from the site. We then used Power Query, which is an Excel add-on, to clean and organize the data, checking for things like completeness, missing values, and formatting. We then use Power Pivot, which is another Excel add-on, to generate descriptive statistics like frequencies and proportions, and then to examine some trends in the data. For the open-ended interview questions about perceptions and experiences from clients and staff, we reviewed those responses and identified major and minor themes. We also reviewed secondary data sources for additional context. So for example, we reviewed a dashboard our health unit uses to monitor opioid poisoning, as well as Public Health Ontario's interactive opioid tool to gain some additional context about drug poisoning in the community.
So step 9 is a very important step. They're all important steps, but oftentimes we conduct the interview, we analyze all the data, but it's really important to make sure we share these findings back out as well. So step 9 is to interpret and disseminate the results. And so for this evaluation, we were able to present findings back at multiple points to the evaluation committee members, which was really helpful because it helped with interpreting the data, providing recommendations, and also the evaluation committee gave suggestions on how to share this data out beyond the evaluation committee, which was really important as well. And before we were actually able to complete all the findings and complete all these evaluation deliverables that we had agreed upon, there was actually the need to have some information sooner to inform the consumption and treatment service site application. And so we were able to pull together a document earlier on, which was able to highlight some of the key evaluation findings, but really focus on the service delivery recommendations that we were able to pull together from the evaluation to help inform the planning and the application for the consumption and treatment service site. So that was really important to be able to, you want the data to be used, so we made sure that we had that available in time for that application. Other deliverables were infographics that we created. We created 2 infographics. One infographic, and these were public-facing infographics. One was focused on describing the key findings, and another was focused on really explaining the actions that the site would be taking to respond to client feedback from what they heard. And so with these infographics, we actually blew them up into poster boards and were able to share them and have them on display at the Guelph Community Health Center and the overdose prevention site to make sure that we were sharing these findings back with clients. That was really important to the evaluation committee. And so what we were able to do is really share, this is what we heard, and this is the actions that the site is taking, so the clients could actually see how their feedback was able to inform and improve the program. In addition to those infographics, we also created summary slides, full slide decks, as well as a detailed report, so that we had all of the findings available and the processes we used in one place that we could share as well.
So after disseminating the results, step number 10 is to apply the evaluation findings. So again, a really important step where you want to actually use the evaluation results. As Kyley mentioned, we were able to share findings along the way with community partners while they were in the process of applying for permanent funding for a consumption and treatment service. So they were able to include our findings in their application for that site. The community center also was able to incorporate client feedback into their day-to-day operations. So in response to client feedback, the site did end up changing their hours of operation. They expanded their staff roles, and they provided more on-site wraparound services like mental health supports. With help from our evaluation results, the community center was able to secure funding for a permanent site and have since been able to do renovations to improve the layout and design of the space. We also did receive a few requests for more information from other health units looking to do similar evaluations. So we've been able to share our findings and interview materials with other health units to inform their evaluation approach if they're looking to evaluate a site in their area. So really making sure that those evaluation results and those findings get used in some way, shape, or form in the community. So that concludes our presentation. Thank you so much for listening. And I'd like to pass it back to Andrea now.
Thank you so much. I'm wildly distracted answering so many great questions in the chat and the Q&A pod. We're going to get to some of your questions in just a second, but first I just wanted to pull a few threads together. I love, Kyley and Rachel, what you really did, which was to bring that 10-step evaluation model to life. And I just wanted to point out a couple of things that I really loved. And maybe I foreshadowed with some of the poll questions that I asked you, because one of the things I love about this example is that you did this all yourselves. You didn't hire consultants. You didn't have a big budget. It took a lot of time, like 16 days alone doing the interview. And I can't even imagine with all of the analysis, but this is something that you were able to do yourselves with the skills that you've obtained through your career and your education. I also love that you engaged community and partners in this process. And we did have a question in the chat, in the Q&A pod, which I'm in the middle of typing an answer to. And I'm going to refer to a podcast episode that Kyley and I recorded about the needs assessment that was one of the sort of precursors to this project, where you've talked, Kyley, about really a participatory approach and a method where you used peer researchers. And you also used a whole variety of methods. You know, one of the poll questions that I had was, is evaluation just a survey? But you used interviews, you used tracking data, you used a whole variety of approaches to collect all of the information that you needed. So I'm going to finish my wrap up, and let's hear what folks who are on the webinar have to say.
Great. Thanks, Andrea, Kyley, and Rachel. We are going to move into the Q&A portion. So there's a Q&A pod. You can put your questions in there. As evaluators, I'm sure you have a lot of very specific questions And maybe we'll start off with expanding that community-based participatory action research approach. So I know in step 2, you talked about you engaged a peer with lived experience to help kind of shape some of the research questions. Can you think of any other opportunities, or were there any other opportunities that kind of presented to involve more community members? And like, if you chose not to, what was your kind of rationale for that, for this specific example?
I think one thing that we considered too, which was really important in this evaluation, was the warm handoff and that help with recruitment. So peers were a pretty integral role there as well, helping to build that rapport, introducing the evaluation to the clients, making sure they understood what was going to be asked for them before doing that handoff to us. So that was one other way that people with lived experience were involved in that experience. I think also, had the evaluation focused on community impact at large, then we would have had another opportunity to speak with community members and gather some different perspectives or perceptions about the site. But given the scope of the evaluation, we did have to pare it down a bit and just focus on the service for the clients and the staff.
Yeah, and I think just to add to that, I think we mentioned as well when we were looking at the resources that we had available, you know, I loved with the needs assessment that was done earlier involving peer researchers to actually conduct the interviews. There's a lot of value in that in terms of having rapport in the community, having trust already established in a lot of ways, and having that common understanding. It was really, there was a lot of benefit in that, and we feel like that project, we were really able to gain information and learn a lot more that we feel like we probably wouldn't have otherwise got if it was just us at Public Health leading those interviews. But again, that does take a lot of resources in terms of training, in terms of hourly pay, in terms of coordination and that piece as well. So unfortunately, we didn't have those resources available for this evaluation. But as we mentioned, one of the members of the evaluation committee was a peer, a person with lived experience who actually also worked at the overdose prevention site and was able to really provide a lot of helpful feedback, context along the way throughout the whole process of the when the evaluation committee was meeting, and that was really helpful as well.
Awesome. Yeah, I'm not surprised to hear that time and money are kind of the big challenges there. I know you mentioned that you had a pretty short timeline for this evaluation as well. One thing I was curious about is there, I know there were some changes made at the community center in terms of hours. Is there any appetite for like a follow-up evaluation, or is there any discussion on kind of what's happening next with your evaluation project?
Well, that's a great question. The plan was that this would be an ongoing and that there would be follow-up evaluation. There was also the plans to include that broader community impact as part of the next evaluation for the site. So that was the plan. As we were kind of wrapping things up is when COVID-19 came along and really caused some challenges, as we know, and we were not able to continue with this evaluation work at that time. So that's probably going to be a consideration in the near future in terms of coming back to here and seeing it, where things are at. Isn't another evaluation needed that was part of the original plan?
Kyley and Rachel, do you have any plans to publish either in a journal or like in addition to some of the great like infographics and stuff that you have shared? Is there an intention to get out there and tell people about your evaluation? $1 million question.
Yeah, that's a good question. I think actually it's important to note that even though we do a lot of planning up front and we think we know what our deliverables are going to be, that did change throughout the process. So for example, we actually didn't intend to write a full report, but then the needs changed and there was more requests for information. So we decided to do a full report. We had also planned to present our findings at a conference, but unfortunately with COVID, that conference got canceled. So I think there's definitely still room to share our findings, whether it's at different conferences or to look towards publishing. But I think it would be of value just to see how those methods could be applied elsewhere.
A question came in just in terms of language. Is there a difference between overdose prevention site and supervised consumption site? Is it just terminology? Do the same things happen there? Can you unpack that a little bit?
Yes, so the overdose prevention sites are more of those temporary sites that are kind of put in place in response to, well, the opioid crisis really helped spur these overdose prevention sites. They just were temporary measures that need to be put in place. But then the consumption and treatment service is more of that permanent funding, and there's different requirements in terms of the ministry. There's different requirements that you need to have that more permanent structure in place, and that application process can take more time, and the services involved are kind of more comprehensive. For the consumption and treatment service site, there's different requirements in terms of additional services that are part of that wraparound support, and so because that is a more comprehensive program, because there's more steps involved in applying for that application, that the more temporary sites, the overdose prevention sites, are supposed to be quicker and just a quick response to a really challenging situation.
Great. My next question, I was kind of curious about when you were collecting the data. I think it was 51 out of 103 clients participated. And did you take some time to kind of like double check why the other ones weren't interested, or was it the incentive or the confidentiality, or was there any kind of like reflection either on this specific part of your evaluation or on your whole overall process? Did you do any kind of like follow-up or debriefing after that?
Do you want to go, Rachel?
Sure. I was going to say, I think anecdotally, like during the process, we were hearing from peers or other people that worked at the site that sometimes clients didn't have time. Sometimes they weren't too sure what we were going to ask them, how long the interview would take. So I think there was just some apprehension around what the interview would actually involve. And I think if we were to do this evaluation again, it would also be nice to hear from people that don't use the site. So part of our evaluation was the clients had to be actively using the site. But that doesn't tell us a lot about why people aren't using the site, what are sort of the barriers of perceptions amongst people that use substances that aren't visiting the site. So I think if we could do the evaluation again, that would also be an opportunity to look into what some of those other barriers are, and then how could the site improve and expand its reach by addressing those barriers.
Awesome. In terms of the kind of like the last two steps, did you think about a video summary in terms of your report communicating its information and conclusions? There was a question in the chat, just in terms of different ways to kind of share your messages.
That's a great idea, and something that we'll consider in the future for sure. I love that idea. We didn't do a video in terms of that, but I really love that idea.
Yeah, I think especially the way that a lot of things are online nowadays and the way the information gets shared, it would be a really useful tool so long as the budget would allow for it.
Andrea, do you have you seen any unique sharing of evaluations by video? Or I know you'll mention a podcast, I'm sure, but
yeah, I may have already done that because I can't help it. So I'm thinking about a couple of things. One is that there is an evaluation method, Dan, I'm forgetting the name of it, but you'll remember, where you actually do participants create videos. Why am I not thinking
like
photo voice? Photo
Yeah.
voice, that's it. So that's an evaluation method and a video all in one. PHO was involved in an Indigenous evaluation of the Healthy Kids Community Challenge, and that's one of the methods that was used for that evaluation. So that was a cool project. I think what's really important when you're talking about disseminating your evaluation results is to really think about your audience. So for instance, like Kyley and Rachel talked about, they weren't intending to do a report, but there was an appetite for that, probably amongst a specific group of people, partner organizations, public health folks, but people who use the site would probably respond a lot better to a video, the infographics, etc. I don't have an example off the top of my head, but I love it as a concept. And if you do one, tell me so that I can tell other people about it.
The only thing I'm thinking of related to that would be Johns Hopkins University has a really great Instagram channel with lots of social media facts. So maybe that's something to leverage in the future.
Yeah, and podcasts, I mean, they're not that new anymore, but they're still a little bit new in the public health field. But that's another really great way to tell people about your projects, your results, your key learnings, etc. Yes, Kyley smiled at me because of course I do another plug for podcasts.
A question came in around recruiting folks for an evaluation committee with broad representation. Can you share any recruitment methods you used for participation for that, and also any other projects you've been involved in, kind of like involving the general public and how you entice them to participate? So that's a bunch of questions, but basically, how do you get people involved and able to help out?
I think one thing I'll say is for different instances when we've been doing community research or community evaluations where we are wanting participation from the public, it really helps to go to where people are. Make sure you know who you want to get involved in that research or in that evaluation or in that project so that you can find them where they're at and make sure you really explain what the ask is of them so that they're informed when they enter into that process. Kyley, do you have anything to add?
No, I think what you said is great, and also in terms of making sure you're clear about what the ask is, and in terms of how they're going to be involved in the process. So being clear about that from the beginning is really important as well. Another project that needs assessment, one that I've mentioned several times in terms of recruitment for that, we really connected with community partners as well. And I think that's a key way to connect with whoever you're trying to reach in terms of your committees or whoever you're trying to engage, is what are the key partners who are well connected and have that trust established as well. And in terms of connecting with those partners and expanding and reaching out that way. So I think partners is a really important piece in terms of who you want to connect with.
Were there any other barriers that you challenged or experienced during your evaluation that we haven't talked about yet, or different ways that you would have overcome some of those obstacles, either from this example or other experiences that you've had in the past?
I think we kind of mentioned it a little bit, but one of the barriers, or one of the things that we reflected on, was in terms of the reach of the evaluation. And so knowing that we really focused on people who were clients of the overdose prevention site. Now that didn't mean that they had to have been regular clients, although we were more likely to have engaged regular clients, because when we're on site, the more time somebody's using the overdose prevention site, the more likely that we're going to be able to connect with them when they're on site. But it is something that we were kind of reflecting and thinking about in terms of, well, how could we have, engaged those who weren't using the site as regularly, or wouldn't it have been neat to connect with those who used the site once and then never came back? Well, what was the reason for that? But it's also really hard to be able to connect with those people because we don't have the contact information, for one. Also thinking about ethics and privacy and all of those pieces that you need to consider. There's a lot of considerations for that. So it's just, it was a little bit of a barrier in that sense, because we were considering it at the time. There was just barriers in place, like how could we reach out to those individuals as well? So that's something that we weren't able to really explore for this evaluation, but something that was on our mind.
Great. I think I'm going to throw a really big question at you about evaluating behavioral changes in health promotion programs. Just a really easy question as we wrap up. You can kind of think about the framework. Andrea, you can also chime in on this one, but it's really difficult to measure that behavior change. So any thoughts, any perspectives, approaches, success stories, feel free to elaborate.
I have a quick answer that hopefully won't sound too trite, and also will probably sound self-serving because I'm in the middle of conducting a literature review on theories, models, and frameworks used in health promotion. And this is one of the really useful things about using a theory or a model in particular, that when you're trying to encourage behavior change theories, like the theory of change, the socio-ecological model, etc., they help you to map out the behavior change that you're seeking so that you can find indicators that are going to show you if that behavior change has been met. So that is kind of my short answer. It's a real challenge that we have in health promotion, which is why Dan mentioned that this is a real big question, because it's very difficult for us to actually measure. You know, we can't always put communities into randomized control trials. For example, to bring up the Healthy Kids Community Challenge again, the kind of founding program that it was based on, EPOD, which was done in France and in lots of places across Europe, actually did BMI measurements, which can be pretty problematic. And so in Ontario, that was decided not to be done. So it's pretty difficult to find sort of proxy indicators. I know with that project, it was done in specific communities. So other communities who didn't participate were used as baseline as well. So there are some ways that you can do it, but I think that having a behavior change theory or model that you're following can really provide a lot of support. Kyley and Rachel, what do you think?
I think that's great, Andrea. But also, just to talk about this specific evaluation as well, we were asking about behavior changes in this evaluation, and it's great because of our open-ended interview questions. We were able to learn a lot more than just, for example, have you because of this overdose prevention site, do you now use safer substance use practices? Like that, rather than just something like that, we were able to have context and deeper understanding. So clients who were able to say, you know, when I come to this site, I'm talking to the nurse and they're asking, oh, is this a newer substance? Is this a new batch? And if it is, you know, suggesting, okay, let's use a little bit less at this time because we're going to test it out. And so that reminder and that conversation, so that's a safer substance use practice, using a little bit less for a new dose. Or also, okay, we're going to use alcohol swabs before you inject, and a lot of safer substance use practices where we had specific examples and highlighting where clients were able to highlight specific changes to their behavior because they used the site and how it kept them safer. So we were able to include a lot of that in our open-ended questions, and then also gather some of that quantitative as well, so that we were able to actually say X percentage use safer substance use practices because of the overdose prevention site. But I think what was really important for our understanding was hearing from the clients in terms of how specifically the overdose prevention site helped with that.
Yeah, I think that was really helpful, being able to gather more detail from them, because oftentimes there's an absence of objective measures to know if behaviors have changed, and you often do have to rely on recall or surveying pre and post program, for example. So when we did our interviews, being able to dig a little bit deeper and have some prompts and chat with people, it really helped in our understanding that although it was self-reported information, it did help us gain a sense of what were those changes for that individual person.
Wonderful. Well, thank you all for presenting us something pre-COVID. I don't remember what I had for dinner last night, so thank you for being able to speak so eloquently about this research project from a few years ago. And thanks everyone for joining us on today's webinar. As you're all evaluators, you can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help improve our programming. And finally, you can access past presentations and view upcoming sessions on PHO's website. Head to the Education and Events tab and click on presentations for that. Thanks everyone, and have a great day.